Hey guys, Dr. Hunt again at Hunt Physical Therapy. Today we're going to talk about a more advanced protocol to treat a herniated disc and address that leg pain called radiculopathy. You may recall from one of my earlier videos, what happens is the disc, which is the shock absorber between the vertebrae, just repetitive stress, sometimes an injury, usually one that involves flexion and rotation, that disc will bulge posteriorly and hit the nerve root, and that's what causes that low back pain and then the radiating pain into the butt and down the leg. So we're going to review that extension stretch that I showed you some time ago to help encourage that disc to get back between the vertebrae. But the purpose of today's video is to expand on that and show you some pretty advanced exercises that you can do to not only treat but prevent this from coming back. So let's start with the extension stretch. As you'll maybe recall, find something you can lean against that kind of hits the back part of the upper legs, because we're going to want to do a pure extension stretch with this, and so don't bend the knees, keep the knees locked out, and then just lean backwards. Go back as far as you can. As a matter of fact, I recommend go back until you feel a little bit of a pinch, maybe a little bit of discomfort. Hold for a few seconds and then come back up. So again, back far as you can. A little bit of pain is not a bad thing, because what you're doing with this extension, you're pinching that disc so that you can promote it going anteriorly and getting off that nerve root. A lot of times when people do this, the first couple reps hurt, but the more they do it, they'll feel that pain centralize and go up their leg back into the spine, which is a good sign. So what I do, or recommend rather, is for my patients to do 3 sets of 20 reps each day. A progression is to lean back and, without losing that extension, side bend towards the painful side. So if the back pain's on the right and the leg pain's on the right, you're gonna lean and side bend towards that side. Again, hold for a few seconds, back, side bend, and then reverse coming out. So extend back, side bend towards the side of pain. When people add this side bend, a lot of times it feels more pronounced. So that's a nice progression. So if you want something real specific, maybe warm up with 10 of these and then add 10 of the extension with the side bend. 3 times a day, 20 reps. Okay, so it's a good idea to spend some time prone. What I mean by that is pretty much face down. We spend a lot of our time flexed, sitting in cars and at work computers, and so doing activities that promote extension are always a good thing. So something simple you can do in your bed at home is just take a couple pillows and just prop up on your elbows, just like this, and just hang out for a little bit. Maybe read a book, watch some TV. There's no set amount of time, but again, this helps offset some of that stress that we put on our spine, spending a lot of times in a flex position. So just hang out like this. Now we're going to go over a couple exercises. One of my favorite for the lower back is a bridge. So to do a bridge, simply lay on your back, push with your feet, and extend your hips in the air like that. You can hold for a few seconds. You can do smooth up and down lifting. I like to pause for a few seconds at the top and really feel it in my hamstrings and my hips and my lower back. I would do about 3 sets of 15 reps, and you can do these several times a week. Okay, the progression would be to do a unilateral bridge. Again, up and down, maybe pause for a few seconds at the top. And then maybe a progression is to elevate your feet, like on a chair or the couch or something like that, and do some bridges with your feet elevated. But that's an excellent exercise for the lower back. While you're here, you might as well address tight hamstrings. One of my favorite is just to grab the back of the upper leg and then extend the leg towards the ceiling till you feel a good stretch in the hamstring. Pause for a few seconds, bring back down. Kick it on up there, pause for a few seconds, and bring back down. This is called an active stretch. You don't have to hold as long, like traditional static 30-second stretches. And each day you'll notice that leg getting a little bit straighter up towards the ceiling. So again, 3 sets of 15, 2 or 3 times a week should be sufficient. Okay, all right. So now let's go out in the gym, and I want to show you some more advanced exercises you can do to help treat and prevent a herniated disc. Okay, let's go. Okay guys, here's some pretty advanced exercises you can do at home with a simple rubber band and an exercise ball I'm going to demonstrate. I would do these 2 or 3 times a week just to strengthen the lower back, to not only treat a herniated or bulging disc, but to prevent it from coming back in the future. So take this long rubber band. We now have our HpT website up and running, and so you can purchase these at HpT&x. We appreciate your support. Free shipping, by the way. So take this rubber band and find a door you trust to stay closed, and just stick it in the door around shoulder height, okay? And so I'm going to show you a couple exercises you can do with this. The first one is a straight arm push down. So arms stay straight, just like the name implies, and push down like that, okay? This is really a great exercise because it works the back, but it makes you engage your core muscles. And so I love doing straight arm push downs. And you can kind of do them like this, or you can put one hand on top of the other, like that. Knees slightly bent, back arch. You don't want to be rounded doing this. And fire off 3 sets of 15, 2 or 3 times a week. Again, here's the variation with your grip wider, okay? So 2 more specific back exercises is a step back and standing rotation. So to do the step back, place the rubber band around your shoulder like that. And to keep the rubber band from falling off, you can put your arm behind your back or like this. Some people even do this, just whatever you prefer. So to do a step back, basically what you're gonna do, you're gonna take a step back and you're gonna lead going back and then forward with the foot that's on the same side as the rubber band. So again, step back with the right and then forward with the right. The other foot is just gonna follow. And it's not a huge step, just kind of like a mid-range step like that. And I find that if I speed it up a little bit like this, I get a little more out of it. So back with the right, forward with the right. 3 sets of 15, and of course you need to do the left side. So reverse it out. And now you're gonna lead going back and then forward with the left foot. Okay, we always want to get a rotation component because the spine doesn't just do these motions here. There's a lot of rotation involved. And so again, put the rubber band on the back of your shoulder. Let me put my arm behind my back on this one. And keep your head looking forward so that you don't over rotate, but basically just rotate back towards the side the rubber band's on. To make the resistance harder with bands, just step away from the door a little bit more. Again, 3 sets of 15. And you want to do both sides, of course. Okay. Again, you're rotating back towards the side that the rubber band's on. All right, 3 sets of 15 there, okay? So now I want to show you kind of a hyperextension exercise that you can do with a inflated exercise ball. So I always tell my patients, get the big one, like 60 centimeters, I think, 50, 60 centimeters. The small one's just not gonna work, but inflate this thing up, and what you're gonna do, you're gonna be face down. You're gonna have the ball kind of low on your stomach, but you're gonna brace your feet against the door, like that. So position the ball as low as you can, kind of on your lower abdomen, and then when you roll out, you'll be able to use your feet to kind of stabilize, and then you can do this hyperextension exercise. You lean back like that. This one really isolates the lower back extensor muscles. Very important for treating and preventing a bulging disc. And again, I always like to just pause for a second or so at the top of the contraction. You'll feel this one in your hamstrings and your hips as well. So again, 3 sets, 15 reps, 2 or 3 times a week. All right, that concludes our exercises for this video. I hope you got a lot out of it. Do these several times a week, and you'll notice that low back pain and that radicular pain should get a lot better. Then once the pain's gone, doing these a few times a week to kind of help maintain and prevent is always a good idea. So if you like, please subscribe. We appreciate your support. Don't forget to visit HpT&x. Check out our cool items we have for sale, and I'll see you next time. Thank you.